Hi, I'm Bonnie Annis,
And I'm Stephanie Prestidge.
and we're here from Lemoore, and today we're going to talk about the connection between vitamin D deficiency and acne. Um, I think the first question, I mean, we all hear, oh, I need vitamin D, I need vitamin D, I need vitamin D. And then there's drops you can take, and there's pills you can take. Can we take a step back and just really briefly talk about why our bodies need vitamin D?
Absolutely. It is needed for overall health and well being with bone density, calming of inflammation. It's kind of like a calcium in a way, but not. There's a way our body converts it and needs it. It's
And we're going to talk about
basic part of human
inflammation.
anatomy. Yeah.
Inflammation. Okay. So, we're going to talk about acne and
And in a completely
and
different way
okay.
that the industry's not used to talking about it. I think
Okay.
that's kind of funky.
So
And
when we
cool.
talk about the industry, for those that don't know, Stephanie is a skincare educator at community college in the aesthetics field, and she's been doing that for more than 12 years now, and in the industry for more than 20 years. So I think that it's very common that people with acne want to put something on it. They want to use triclosan. They want to
Yep.
use tea tree. They want to use retinols.
Retinols,
Oh, they what
benzoyl
else? Oh,
peroxide is
that's
another big one.
yeah, that's
Stripping
harsh.
cleansers.
Oh yes, oil free this, oil free
Strip it
that.
all off.
Yeah, scrape it, strip it. It's horrible. But what that ends up doing is it sometimes it gives you a temporary fix.
Yeah.
Sometimes,
Sometimes, yeah.
especially things like Accutane. But what it ends up doing is impairing your skin barrier and causing damage further down the road, causing more inflammation further down the road. So now what we know is that there's a link between the vitamin D in your body and the levels of vitamin D in your body and acne. And I think also there's a connection with your stomach. I feel like there's a
Yeah.
connection there too, but maybe we're not going to get a chance to cover this today. That's the thing about this series of microbiome discussions is everything is connected, and the answer is yes, it's about your microbiome. And we have to keep talking about it in little chewable pieces to be able to understand it all. And it's only after a really lengthy discussion that you can kind of get the whole thing.
Yes.
So we know that our body needs vitamin D. How do we get vitamin D into our body if we're not going to take a pill? Because I think we can all recognize that that's not optimal. Taking a pill is
Yeah.
not the solution, really.
Yes. Yeah. I know we think that if we just take an oral vitamin D that it just fixes everything. There's a lot of research and science that we actually need to absorb vitamin D through the skin is the best absorption. So when our body actually metabolizes vitamin D, it goes through, you can put it in a triangle shape, triad effect in the body. Um, Vitamin D is properly synthesized through skin organ, kidney organ, and liver organ.
But
So
it has
just
to get in from your skin to get to the kidneys to get to your liver.
and to have the proper metabolism of your body.
Right.
And this is from peer-reviewed science research, so it's not just pulling this out of left field.
We do have a really nice piece of research from PubMed, and it is a comprehensive review of the role of the microbiome in acne.
Yeah.
We know that acne is an inflammatory condition, and we know that a balanced microbiome, a diverse microbiome, is going to reduce inflammation and create a strong skin barrier, and it's all connected. But
Absolutely.
I think that everything I've been hearing over the months we've been having these discussions every 2 weeks is that we need to get outside.
Yes. So I think we're now seeing change. As we've talked about it before, hunter-gatherer communities. We've talked about it before. That's not new. People that live completely on the land. Um, People that live completely on the land still go through cell division, cell proliferation from each shed. They still develop hormones, as all human beings do. There's still puberty and aging, and our hormones happen to everybody. So when the industry has typically looked at sebum production being an issue, supposedly, over skin development, hyperkeratosis, supposedly the issue, and hormones, supposedly the issue. Okay, well, in hunter-gatherer communities, they go through all that too.
They have hormones, they have sebum.
But there's no papules and pustules ever found on the skin by dermatologists doing the studies. So how is that? How is that the culprit always?
Too much oil on your skin is not the cause of acne. So things like triclosan, benzoyl peroxide, tea tree, salicylic acid, all of those very, very strong ingredients, natural, not natural, both.
Yeah.
But
yeah.
they do the same thing. Same with retinoids. They do the same thing. They are just looking at what's on the surface, and they can come with lots of side effects. So the solution, however, to the inflammation of acne is a balanced and diverse microbiome.
Absolutely.
With good sebum levels, healthy sebum levels on your skin.
Healthy sebum.
And that is connected to vitamin D. And we're going to put the link to the research so you can read it yourself in the description of this video. But let's just talk a little bit about the connection of lower levels of vitamin D and acne. What do we know about that?
That's the interesting part. When it was discovered, it was kind of a big flip because first things first, they still don't know what actually completely causes acne, the disease. Like, we can speculate and try to help the disease, but there's no cure for the actual disease. So that's important. Second, Esse itself actually did research along with others that have done research too, but they brought in individuals, human beings, that have acne and the different severities of acne. And what they actually discovered in grade 3, grade 4 acne, when it gets to papulopustular and into cystic nodule acne, where there's more inflammation and pain, a lot of inflammation, they discovered through basic blood tests, nothing crazy, no scraping the skin, nothing, through a basic blood test, they discovered that their vitamin D serum levels in the blood test were way down, like way, way down.
And so is this around the world that is experiencing low vitamin D levels in the blood?
Yep.
Huh. I mean, I can see here in the northern hemisphere, we know that Esse is from South Africa. It's manufactured in the southern hemisphere. So
yes, and the studies were done, I believe, there or Germany is normally where they do their studies.
Okay.
So yeah, it wasn't just here.
Okay.
Yeah. Yeah, and it was from a blood test. It wasn't actually looking at the skin.
Okay.
It is looking at skin, but it wasn't tested on skin.
What then can we correlate with that? Can we say then that higher levels of vitamin D, do we know that higher levels of vitamin D are going to reduce inflammation and acne?
Well, again, as you said, it's not one approach, and I think that's a challenge the industry always took, is it's a one approach.
They're looking for that magic pill.
The blame was P. acne.
Right.
Which we now know is called Cutibacterium. Another whole topic, I'll leave it alone, but they want something to blame. And the thing is, it's not one thing to blame. So the research you were just mentioning as well talks about gut health and our gut microbiome, and specifically the intestinal tract, and diets that are lacking in fiber, leading to more inflammation.
Interesting.
And inflammation affects skin too. So it's an organ.
I think that the message here is that there's no quick fix. There's no magic pill. I think that getting outside, we've said this over and over again, that getting outside 15 minutes a day without an SPF on. This is really hard for a lot of us in North America, where, especially for estheticians that are taught, you must not send a client out of your spa or aesthetics room without SPF on. And really, there's something to be said for SPF depending on your level of sun exposure, but the idea being that you can reduce the inflammation from acne with 15 minutes a day of unprotected skin, unprotected exposure to the sun, preferably in the earlier morning before the sun is up too high. It is not difficult to do, and it's a prescription. It's a prescription that you need to follow to reduce that inflammation. And I am going to suggest, like Stephanie's always said, to journal that too. If you're dealing with painful inflammatory acne, I think that is absolutely something you could do at no cost. I know that we sell stuff. we are aware that that's our job, is to sell products. And we also want to make sure that people understand that it's a lifestyle thing too. So let's talk a little bit about products now. So we know that Esse did some blood work for people.
Yes.
What is the solution that Esse presents for acne treatment using products?
It's a really good question. A 3-ingredient approach. I'd say I'd focus on 3. Of course.
Still nice and simple.
Yes. Provitamin D is significant. And why provitamins is not a vitamin yet.
Okay.
It has to be activated for your body to absorb it or for your body to metabolize it. So it needs sunlight to work. You need to put outside. So when you use the clarifying oil on your skin, you need to go outside for 15 minutes to make it work.
Really?
Yeah, you need sunlight to make it actually.
It's like your superpowers activate.
Yeah, exactly. So you need it to go outside, and it'll synthesize and help with the inflammatory. So vitamin D is the inflammatory approach, treating the inflammation, the pain.
Okay.
The part that even prescription medications don't focus on.
No.
They don't. They focus on what they call the bacteria or stripping the skin. So 1. 2, we've talked about it before, which I know you love, bakuchiol. So a low percentage of bakuchiol instead of retinol.
Nature's retinol.
Yeah. So no side effects of retinol.
So this contains 0.5% bakuchiol versus the bakuchiol serum, and we just like saying bakuchiol. I was like, bakuchiol. This is a 1% solution of in the bakuchiol serum. So the clarifying oil has got bakuchiol.
Yep.
And what else in it?
Provitamin D.
Provitamin D.
And 4
4
live probiotics. Because again, diversity.
Right.
When the skin is really inflamed with acne, there is a pathogenic microbe or one of your good microbes too much. So it's not always pathogenic with acne.
Okay.
We automatically thought it was. No. It could be an overgrowth of one of your own microbes.
So the key is balance.
Yeah. So having 4 is creating diversity. And that's where with hunter-gatherer communities, they're always in diversity all the time. It's not just human to human microbes. It's plants, it's animals, it's water, it's soil, it's everything.
Okay.
Diversity.
Yeah, right. And it has to come from everywhere. And I again, it comes back to food for me. I always think of it in terms of food and having a balanced diet. For me, what that means is lots of vegetables of different colors, protein sources from a variety of places. And I think we've talked about this before, that humans in our culture tend to eat a very small range of things. So we need the diversity of those ingredients in skincare. And that is within the clarifying line. What other things might somebody use within that clarifying line or not in the clarifying line to work through their acne situation?
Also hydration, too much stripping of the skin. Even going to hyaluronic acid, but a low molecular weight, so it actually absorbs into the skin.
Okay.
Help that tight junction, help keep it stronger. A good moisturizer is still always needed. I brought light moisturizer, but what does their skin really need? They could maybe in the winter months go a bit heavier or lighter, but protection is also important.
Yeah.
Because this organ is to the world.
And certainly here in the Northern Hemisphere and in Canada where we are, we do need that moisture. We are inside with indoor heating.
Yes.
It's even when you spend time outside, it's quite dry. The air is quite dry once we get the snow on the ground. So it's definitely going to be something they need to. So there's no magic pill.
Yes.
Get outside, get your 15 minutes a day. Choose something like the Esse clarifying oil with 4 key ingredients that is going to help reduce the inflammation and reduce the painfulness of the condition, along with some other things too, good cleansing, gentle cleansing, and good hydration. Also, We're here to answer questions. I know that acne is a really painful condition that a lot of people are nervous to talk about, or who are traumatized from having gone through some very, very strong prescription medications, things that hurt their skin.
If not their internal body. Some of them can even have side effects of internal body.
So we want to make sure people can get the help they need in a gentle way that enhances their microbiome, some with products and some with lifestyle choices too. So please feel free to reach out to us if you have any questions. Stephanie is always here to answer your questions. Thank you so much for joining us today. We'll see you in 2 weeks.
Bye.